Hi everyone. For those of you who don't know me, my name is Francesca Moresi and I am a qualified psychotherapist. I am also a person who has been in therapy for many years, and today I want to talk to you about psychotherapy from both perspectives, the therapist and the client. And I would like to explore with you what psychotherapy is and how it works and what can be covered. The reason why I want to do this is because I know that it's quite difficult to look into different terms such as psychotherapy, counseling, or psychology. Many people who are considering to approach therapy can be easily put off because they don't know what to expect, they are uncertain about the methods, results, and it can be really confusing. So, in this video, the first thing that I want you to know is that psychotherapy is essentially taking care of yourself. Going to therapy means going into a room with another person, your therapist, and talk about any of your problems, any difficult feelings you may experience. The point is to feel safe and not judged when you do this, knowing that what you reveal will remain confidential. By talking with your therapist, you enter a process of healing, and the aim is to increase your well being, to feel happier, hopeful, more confident, and, for example, less low or anxious. This process can take place because you want to change something in your life or because you want to learn more about yourself and explore your thoughts and your emotions. These can lead to a greater self awareness. But you have to remember that psychotherapy cannot be successful unless you really want to be there. Everyone can generally benefit from psychotherapy, in my opinion, but only if they are motivated. It is normal to have some doubts or to be unsure at the beginning, and if you do, I would encourage you to explore those doubts or concerns together with a therapist. This will help you in your decision making toward therapy. In fact, therapy can be hard work. First of all, it is not as though you were talking to a friend. It's actually rather different. Both client and therapist need to be actively involved in psychotherapy. A therapist is someone skilled and is there to listen to you with care and empathy, but they won't tell you what to do. Instead, they will encourage you to talk about what's bothering you in order to identify any root causes and analyze your specific patterns of thinking, behaving, and feeling. This means that you will fix yourself. Your therapist will facilitate the process where you learn to help yourself and to find your own answers. Isn't this wonderful? They will give you the tools to deal differently with life issues, learn the triggers from your symptoms, and build resiliency so you can feel more empowered and less dependent on psychotherapy. Second, psychotherapy does not always make you feel better straight away. Talking about certain experiences or trauma can bring back some unwanted and difficult feelings. Those feelings that we always tend to suppress because they are indeed quite overwhelming. So, recalling memories requires courage and can be upsetting, but eventually, letting these emotions out in a safe environment can help you feel lighter and reduce your symptoms. In this way, psychotherapy will teach you to bear a certain amount of frustration that can be useful in your daily life. As you can see, psychotherapy is a collaborative effort, and not just during the sessions, but also during the week. Your therapist may give you some homework, for example, such as keeping a journal of your emotions and thoughts. Going back to the process, when I meet a client for the first time, I normally explore with them what the reason is that brings them to psychotherapy and what their symptoms are. When I say symptoms, I refer to any problems in your state of being, such as anxiety or low mood, insomnia, binge eating, feeling helpless, feeling insecure, and so on. The scope of this first session is also to get to know each other and see if we are a good fit for working together. I believe this is something absolutely important. How do we choose what kind of psychotherapy we should do? My recommendation would be choose a therapist instead of a therapy approach, unless, of course, you have a specific prescription. In any case, you need to feel comfortable and open in front of your therapist. In fact, there are so many styles of psychotherapy, and a lot of research has been done. Basically, all of these different approaches have been proven to be fundamentally helpful. So there is no right or wrong kind of therapy. Potentially, any approach is actually really good. What makes the difference is your actual therapist, the person that you decide to open up with. In fact, the biggest factor of change in therapy is the trusting relationship that you build with your therapist. A new experience of a caring and healthy relationship with your therapist is what will allow you to heal and change the way you relate to people. So, how does it work after you've made the choice to actually engage in this process with your therapist? What I normally do in my own therapy room at this stage would be carrying out an assessment. This means assessing the symptoms and create a map of what a client is experiencing. For example, how often they feel anxious, for how long they have been experiencing, let's say, lack of motivation and low mood, or, if any suicidal thoughts are present. And then I also ask my clients to tell me their story. This is a moment that I particularly love, exploring a person's story. And in my experience, it's usually the first time in their life that they are asked to create this narrative. In fact, think about it. Whoever asked you to describe your family story and your own story? What I do is starting from the family of your grandparents, then we go to your own family and we explore the figures of your mother and your father. We talk about any siblings or any other person who was relevant to your upbringing, either in a positive or negative way. We have a close look into the kind of relationships that you had with these family members, and again, other important people in your life. And we also talk about your own personal development. I think this is really, really interesting, and it can already be very therapeutic to talk about yourself while you are listened to carefully by your therapist. And this part normally takes maybe 2-3 sessions. It really depends on how old you are, and it's something that I find particularly fascinating. This process normally allows me to have a lot of information that I will use in the work with my clients, but also it allows the client to create the narrative of their own story. And doing this can bring to the surface a lot of feelings, and it enables people to understand what it is that they want to work on in therapy. Perhaps they can notice that there are some unfinished business that they want to focus on. Or perhaps they can feel that there are particular feelings or emotions that they would like to learn how to cope with. There may be dysfunctional relationship patterns that they want to explore and change. And this is why it's at the end of this process that we decide what the goals of our therapy should be, and we set a plan of action. Normally, I ask my clients to come up with what is it that they would like to achieve in our path together. And then this is like a map, a guide for the both of us, so that I know where I am guiding them and they know where to go. And at the end of therapy, it's actually rather easy to understand if we have achieved those goals. This, I'd say, is the first part of a therapy path, at least in the way I work. After these initial sessions, then we actually start the central part of therapy. And at the beginning of every session, I ask my clients to tell me what it is that they want to talk about today. In fact, in my therapy approach, which is called Gestalt, it's really important to focus on the present moment, on the here and now. Clients often ask me the question, what should I be talking about today? I tell them to close their eyes, connect with themselves, and let sensations and emotions rise. And it will become clear which topic feels more urgent. In a nutshell, think of it as a picture. In a picture, we always have the focus and the background. Although both are important, your attention is on the focus. If we try to focus on the background, it is hindered by the focal point of the picture. The same happens with your thoughts and feelings. We need to find the focus because that's where your attention really is. So, we want to deal with whatever is present, and if we realize that what we are working on is impacted by something that happened in the past, then we go back for a moment into the past and we may decide to look at unfinished business to resolve it. And then the present can also change. Therapy is a healing process, and during this process, you can learn many skills and coping strategies that can help you deal with stress or problems in your life. It is also an incredible opportunity to express yourself in ways that you have never dared before. Always, of course, respectfully of other people in the room. This can be very relieving, especially if you carry secrets and if you don't usually open up much with friends and family. Sometimes I tell my clients to look at therapy as though it was a gym, where they can actually go and practice new and different strategies to improve and feel more empowered. This happens a lot in the relationship with me. If you can try to relate to your therapist in a new, healthy way, you can taste the consequences of how this feels to you. And when you will feel ready, you can then try this with someone outside therapy, perhaps someone you really trust, and then extend this to others. Sessions are typically held once a week for about 50 minutes, but this can vary from case to case according to the clinical judgment of your therapist and their approach. Some clients may, for example, benefit from 2 sessions per week if they are experiencing a particularly rough time and they need more support. Psychotherapy can be short term, a few sessions, dealing with immediate issues, or long term, months or maybe years, dealing with long-standing and complex issues. So far, I have described one-to-one psychotherapy, but actually, you may decide that group therapy is more suited for you, especially if you're interested in working on the way you relate to people. The therapy setting could also include your partner or your family if you want to work specifically on the relationship with them. Now, let's have a look at what psychotherapy can cover. Psychotherapy can be used to treat a wide range of problems, including depression, anxiety disorders, any personality disorders, obsessive compulsive disorder, post-traumatic stress disorder, eating disorders such as bulimia or binge eating or anorexia, any drug or alcohol misuse, self-harming, and suicidal thoughts. However, you don't need to suffer from one of these issues to go to therapy. We all feel sad or anxious or overwhelmed from time to time, and we may want to be supported. Therapy can be for anyone who has stress in their life and they would like to learn how to deal better with the stress. Anyone who keeps repeating the same patterns over and over again and they would like to change their behavior because they feel as though they are stuck in the same old patterns. Or you may decide to go to therapy because, for example, you have lost the ability of coping with everyday problems and you'd like to regain that ability. Or maybe you constantly feel angry or on edge and you would like to go back to a healthier emotional way of being. Maybe you are experiencing low self esteem. Maybe something is happening in your life and you feel as though you have lost your confidence. Maybe you have suffered a loss or endured a trauma, or perhaps you had an abortion or a miscarriage. Maybe you're going to take a big step in your life, such as changing job, getting married, or having a child, and you would like to approach these changes with a greater self awareness and explore what it means to have a career shift, or to get married, or to become a parent. As you can see, there are plenty of reasons to go to therapy, and everyone who feels ready to engage in this process can benefit from it. I really hope I was able to give you a clear overview on psychotherapy. Please do let me know here in the comments if you have any questions or if you would like me to cover more about this topic. Thank you so much for watching my video today.